Welcome. My name is Dr. Melody Keith. I'm here at Lakeway Aquatic Physical Therapy here in beautiful Lakeway, Texas. And today what we are talking about is hip pain. And what I want to do today is just really kind of give you some ideas about what's happening in the hip and what can physical therapy do. Actually, just yesterday I had a client that talked to me about, I let my hip pain go for so long, now my knee is killing me. And that is very classic. The two work together. Sometimes when you have a hip biomechanical issue, then you also have a knee. So I'm here to try to explain a little bit about in our short little Snapinars. These are just little tidbits to try to get you on the idea of what might be happening to you and how we here at Lakeway Aquatic Physical Therapy can help with your hip pain. So if you have hip pain that is keeping you from doing just normal activities, like, I want to take the dog for a walk, okay? If that's keeping you, no, I can't go, it hurts too much when I walk the dog, then you need to see physical therapists. You need to go in and check it out. See what we can do. Physical therapy, what we do is we check, we have special tests, we have things that we work on to make sure that the pain is coming from your hip or coming from your back or maybe even coming from your knee. And then we're able to give you exercises to do. Here at Lakeway Aquatic Physical Therapy, it is ideal because we can take you to the pool and do non-weight bearing things while we help your hip and get it back to where the mobility there, and then help with your strength. So if in your hip pain, and I'm just going to kind of show you the hip, within the hip socket, right, we have that hip socket. The hip joint is a very large joint, but if something happens and you have a trauma to it or you injure it and the tissue around the hip joint, then you start getting pelvic pain and you may get knee pain. So the hip is a big joint and it really requires a specialist to be able to diagnose what's going on. So again, if everyday activities such as just going upstairs, you're like, I'm not even going upstairs to clean because I can't do that. It hurts my hip. If something happens and all of a sudden you're having pain with sitting and you're having pain with standing, then you need to see a physical therapist because again, those are not normal signs and symptoms of just a hip. I don't want everybody to think that just because you have hip pain that bam, I need a hip replacement. That's not it. Out of my patients, maybe 8 out of 10, I can help 8, they never get a hip replacement. Yes, there are a few that do need a hip replacement, but most people do not need to get a new hip. They just need to get in and become more active, more mobile, get some stretches, get some flexibility on them, gain some strength, and then get that hip back healthy again. And that's what we can do. If you have swelling, if you feel like it's swollen in there, if you feel like things are just not moving and you keep from moving, you stop moving, then that's going to affect your hip. So I'm just here today just to kind of to give you a broad basis of the hip and the pelvic girdle to try so that you understand that not all pain is so severe. And when you come to physical therapy, one of our biggest goals is to get you out of pain so that then you can enjoy walking the dog, going up and down stairs, doing things that you like to do, getting your functionality back. So at Lakeway Aquatic Physical Therapy, we would love to see you. Give us a call. Come by. We're here in Lakeway. If you have any questions, we'd love to talk to you about it. You can ask us questions, and I can do my best to give you an answer. It is very hard to give you an answer without actually coming in for an initial exam so that I can put my hands on you and actually feel what is going on in that hip capsule to make you feel better. All right? I hope you have a great week. We'll talk to you at our next Snapinar. Please, if you like us, please subscribe to us. And you can catch us on Facebook. You can also catch us on YouTube. Our website has all of our videos, our whole series of videos. We have ones that have knee pain, ankle pain. If you have lower back pain, just go to our website, scroll down. You'll see the Facebook page as well as the page for YouTube. And you can go there and watch these little Snapinars that will give you some hopeful information for you and your pain. All right? Have a great week. Thank you very much. Have a great day.